As the deep fascia of the thigh divided the region into compartments, we will now look at the muscles in the anterior compartment of the thigh. The muscles of the anterior compartment of the thigh are the sartorius, the quadriceps femoris, which comprises of rectus femoris, vastus medialis, vastus intermedius, and vastus lateralis. We will talk about these muscles, their origin, and insertion one by one along with other muscles that are found in the region of the thigh. Let's start by looking at the sartorius muscle. The word sartorius in Latin means talar. It is long, narrow, and ribbon-like muscle. It runs downwards and medially across the front of the thigh. It is the longest muscle in the body. The muscle originates from the anterior superior iliac spine and the upper half of the notch below the spine. The insertion site of this muscle is at the upper part of the medial surface of the shaft of the tibia by the common tendon of the pes anserinus. The pes anserinus is commonly said to be constituted by the tendons of three anatomical structures, namely sartorius, gracilis, and semitendinosus muscles. The sartorius muscle is innervated by a branch of the femoral nerve, the M1 branch, from the anterior division of the femoral nerve. This muscle is an abductor and lateral rotator of the thigh, as well as the flexor at the knee joint. I mentioned that the word sartorius is a Latin word meaning talar. You can remember the action of this muscle by keeping in mind that these actions are involved in assuming the position in which a talar works, such as the palthi posture used during prayer sessions also. Now let's talk about the quadriceps femoris, a group of muscles. It is a group of 4 muscles located in the front of the thigh. The 4 muscles that make up the quadriceps femoris are the rectus femoris, vastus lateralis, vastus intermedius, and vastus medialis. All of that work together to extend the knee. Let's go through them one by one, starting with the rectus femoris. The rectus femoris is fusiform. It runs vertically on the front of the thigh superficial to the vasti. Its superficial fibers are bipinnate and the deep fibers are straight. The straight head of the muscle originates from the upper half of the anterior inferior iliac spine, and the reflected head originates from the groove above the margin of the acetabulum and capsule of the hip. Both the head of the muscle then converge and are inserted at the base of the patella, anterior to the vastus intermedius muscle. The rectus femoris muscle is the only component of the quadriceps that crosses the hip joint, and it flexes the hip in addition to extending the knee. The rectus femoris is innervated by the M2 branch of the posterior division of the femoral nerve. This branch also supplies the hip joint. The action of the muscle is different on 2 joints in the region of the thigh. It acts as a flexor at the hip joint and an extensor muscle at the knee joint. It is also called the kicking muscle. In fact, all 4 muscles, that is the quadriceps muscle, are kicking muscles, as they help you straighten your knee so you can kick, run and jump. Now let's look at the 3 vasti muscles of the thigh. The 3 vasti are wrapped around the shaft of the femur in the positions indicated by their names. Starting with the vastus lateralis first. The vastus lateralis muscle forms a large part of the quadriceps femoris. As you can see here, it is a bulky muscle. The muscle fibers originate from the femur. To be precise, from the upper part of the intertrochanteric line and linea aspera, and from the anterior inferior borders of the greater trochanter as well. The fibers of this muscle converge and are inserted at the lateral part of the base of the patella, the upper 1/3 of the lateral border of the patella, and the expansion to the capsule of the knee joint, tibia, and iliotibial tract. This muscle is innervated by the M3 branch of the posterior division of the femoral nerve. The M3 branch also supplies the knee joint. As for the action of the vastus lateralis, the muscle acts as an extensor at the knee joint and plays a role in standing, walking, and running. The next muscle is the vastus intermedius. Vastus intermedius is situated in the center of the anterior compartment of the thigh, underneath the rectus femoris, with vastus medialis and vastus lateralis on either side of it. The vastus intermedius also originates from the femur. Specific sites or origins are the upper 3/4 of the anterior and lateral surfaces of the shaft of the femur. The insertion site of the muscle is found at the base of the patella, just posterior to the insertion site of the rectus femoris. This muscle is innervated by the M5 branch of the posterior division of the femoral nerve. The M5 branch also supplies the knee joint and articularis genu. The action of the vastus intermedius muscle is the extension of the leg at the knee joint. It also plays a role in the stabilization of the patella. The third vasti muscle is the vastus medialis. The vastus medialis is the most medial of the quadriceps in the anterior compartment of the thigh. The vastus medialis also originates from the femur. Specific sites or origins are the lower part of the intertrochanteric line, the upper part of the medial supracondylar line, and medial lip of linea aspera. The muscle fibers move downward and are then inserted at the medial 1/3 of the base and upper 2/3 of the medial border of the patella, expansion to the capsule of the knee joint. This muscle is innervated by the M5 branch of the posterior division of the femoral nerve. The M5 branch also supplies the knee joint. The action of the vastus medialis is extremely important for the stability of the patella, because it prevents lateral displacement of the patella during knee extension. The muscle also rotates the femur medially during the locking stage of the extension of the knee joint. Now that we have talked about all 4 muscles that make up quadratus femoris, here you can see the 3 vasti muscles together in this illustration. The rectus femoris muscle is present at the anterior aspect and covers these 3 muscles, as shown here. Together, these 4 compacted muscles are known as the quads or quadriceps femoris. Collectively, these muscles are of great clinical importance. The patellar tendon, or the tendon that arises from the quadriceps femoris, can be tested by tapping the patellar tendon just below the kneecap. The reflex can be elicited, and the contraction of the quadriceps muscle can be observed. This is known as the knee-jerk reflex, or the patellar reflex, which is checked as part of a neurological examination to assess the integrity of the nerve pathways involved in the reflex arc. Another important point about the quads to keep in mind is that intramuscular injection can be given in the anterolateral region of the thigh in the vastus lateralis muscle. Other clinical implications of the quadriceps muscle include the following. Knee extension. The quadriceps muscle is the primary muscle responsible for extending the knee, which is important for activities such as walking, running, and climbing stairs. Weakness or injury to the quadriceps can result in difficulty with these activities. Patellofemoral pain syndrome. The quadriceps muscle plays a crucial role in patellofemoral mechanics, and weakness or imbalance of the muscle can lead to patellofemoral pain syndrome, PFPS, which is a common knee disorder. Osteoarthritis. Weakness of quadriceps muscle is associated with an increased risk of knee osteoarthritis. ACL injury. Quadriceps muscle weakness is a risk factor for anterior cruciate ligament, ACL, injury, which is a common knee injury among athletes. Falls prevention. Quadriceps muscle strength is important for maintaining balance and preventing falls in older adults. Overall, the quadriceps muscle plays an important role in knee function, and weakness or injury to the muscle can have significant consequences on both function and pain. Other than the 5 muscles that we have discussed so far, a muscle called the articularis genu is also found in the anterior compartment of the thigh. The muscle is small and consists of a few muscular slips that arise from the anterior surface of the shaft of the femur, a few centimeters above the patellar articular margin. It is inserted into the upper part of the synovial membrane of the knee joint. It is supplied by the M6 branch, a sub-branch from the M4 branch from the posterior division of the femoral nerve. They pull the synovial membrane upwards during the extension of the knee, thus preventing damage to it. Additionally, from their points of origin on the posterior abdominal wall, the psoas major and iliacus muscles' terminal ends to enter the upper section of the anterior compartment. Even though these 2 muscles are not generally thought of as being a component of the anterior compartment of the thigh, we will nevertheless quickly discuss them because they are a part of the thigh. Iliacus and psoas major muscles form the lateral part of the floor of the femoral triangle, as we have discussed earlier. They are classified as muscles of the iliac region and also among the muscles of the posterior abdominal wall. Since the greater parts of their fleshy bellies lie in the posterior abdominal wall, they will be described in detail in the section on the abdomen. However, on account of their principal action on the hip joint, the following points may be noted. Both have a common insertion on the lesser trochanter of the femur and are the chief and powerful flexors of the hip joint. Both are supplied by spinal segments L2, 3. The psoas is supplied by the branches from the nerve roots, whereas the iliacus is supplied by the femoral nerve. So, in conclusion, muscles in the anterior compartment act on the hip and knee joints. The psoas major and iliacus act on the hip joint. The sartorius and rectus femoris act on both the hip and knee joints. And the vastus muscles act on the knee joint. You can also use this categorization of muscles to better memorize the muscle of the front of the thigh. That is all about the anterior compartment of the thigh. You can watch our related videos on the region of the thigh and medial and posterior compartments by clicking on the links in the description below.
Watch our medical videos anytime and anywhere. Download sqadia.com app now.